through this list if that works for everyone. And I hope the audio is coming through okay. So in terms of case count, we'll start with case counts and just talk about the local situation. We'll share some updates from the state. And we'll talk about some of the new orders and initiatives and advisories that we have been working on. And then we'll hopefully have some time for a roundtable just looking ahead about the kinds of things that as a medical community, we should really try to focus our efforts on. I guess, we at the Department of Public Health, we are in sort of a strategic pause. We've been in the red tier for 3 weeks. We're very thankful that we've come this far, but we know that we're in it for the long haul. We're actually planning kind of a stakeholders meeting just by way of a strategic pause, which will take place next Tuesday. And hopefully we'll be able to talk about where we need to go so that we can continue to make progress and continue the response to coronavirus that we need to do. At the same time, I know that this medical community is very diverse, that there's a lot of other needs that at the public health level we should be discussing and talking about. And so I think that it's probably an appropriate time to start thinking about how, in fact, we are going to deal with other public health issues while at the same time trying to deal with coronavirus, knowing what we know so far. I guess, the phrase that comes to mind is the new normal, is that, this is going to be with us for the next few months. But we need to move on and address some of the other perhaps neglected issues related to public health that we know are out there. And so hopefully, like I said, I'll update everybody about mostly coronavirus stuff, but I'm happy to hear about other things that perhaps we should be addressing too. By way of situational awareness, right now on our dashboard, we have 29,579 cases and 424 fatalities registered in Fresno County. In the hospitals, we have 91 hospitalized cases and 17 in the ICUs. The state also tracks something called the homelessness impact, which I don't know if you've had a chance to see what that actually means, but this is part of a project called Project Room Key. And they've really secured almost 20,000 rooms across the state, including almost 350 here in Fresno County. We're using them to house homeless patients who are either at risk, have been exposed, or have been diagnosed with coronavirus. And so this project is a really nice project that allows people to take advantage of these hotel rooms that have been secured with state funding. It's not something that we talk about all the time, but certainly the homeless community and the advocates for the homeless community are doing a great job using this resource to the best of their ability. It's been one of the great successes, I think, of the coronavirus response is the fact that we've been able to help hundreds of homeless people actually get shelter and hopefully get a little bit more stability in terms of other chronic illnesses that they might have, and really get them plugged into a kind of safety net that they didn't have before. And hopefully we can capitalize on the momentum that we've been able to achieve and really help them find long-term solutions to their homelessness crisis. As you can see, there's still some hotel rooms. There's almost 15 hotel rooms that are not being used. And that's just in Fresno County. There's this Room Key project is actually activated all over the Central Valley. And we're hoping that we can actually start using other resources with this model, including for agricultural workers or farm workers that just want to quarantine away from their families if they're living in a very densely populated home situation. They can actually access this program or other programs that are similar in order to get housing away from other people so that they're not exposing other people or get exposed to other people if they're at risk. So that's called Project Room Key. Another issue that is of local importance, which hopefully those of you who need to hear it have already heard about it, but if you haven't, then let me explain. the state is actually creating a playbook related to COVID-19 vaccination. Even though there's not a COVID-19 vaccine that has been approved yet, the state is already kind of figuring out how best to deploy this vaccine, including, how many healthcare workers do we need to vaccinate, assuming that they are at higher risk? How many other high-risk populations do we need to vaccinate? How are we going to distribute this vaccine, which will need to be kept cold, so that we have to have a cold chain that's established and maintained and secured for these vaccines to remain good, and really all kinds of other logistical issues. So they're asking people to complete a brief survey. They should take you no more than 15 or 20 minutes, and it's at this SurveyMonkey link. Hopefully you've already gotten this email, and hopefully you've already done it, because it's due October 16th. It's due in like 2 days. But it's a very short survey. It's just a very global overview. They want to hear from every single general acute care hospital in California. So if you're at a general acute care hospital and you're in charge of filling out surveys for the state, then consider tag you're it. Please get this filled out and work with your team to get that information. If you have any trouble or need any technical assistance with getting it done, we're more than happy to help you, but this is really just a state memo, and they've been reminding us at the health department to remind you at the general hospitals to please complete this survey. Lastly, we're doing COVID testing and flu vaccination at the Big Fresno Fair. So I just want to thank all of the partners that came together. Our own team here at Public Health has been stellar. The Fresno Equity Project has come out to do COVID testing. A lot of our community-based organizations are out there providing educational handouts and making sure that patients get the information that they need. It's actually relatively underutilized. So we're only testing a handful of people every day. So please get the word out that this is available. This is really something, like I said, we're really trying to find innovative ways to deploy vaccinations. And if this works out, this could be something else that we roll out for coronavirus vaccination also, is to do a drive-through vaccine at the Fresno Fairgrounds. So please spread the word. Get all of your patients who need it tested. If you're not able to do testing yourself, then you can send them to the Big Fresno Fair, where the line is very short, is what I'm told. And they can also get their flu vaccinations there, along with a lot of other places like pharmacies, et cetera. Those are all the local updates. In terms of the state, so you've probably heard that we're still in the red tier this week. And so that's part of the blueprint for the safer economy. And the red tier is what's assigned to us, because we currently have a positivity rate of 5.1%, and we currently have a case rate of 6.5. Now, the positivity rate is something that is broken out by quartile. So the average positivity rate for the county is 5.1%. That's pretty good. We're actually in the orange for that positivity rate. However, with the equity metric, they're also looking at the lowest quartile, which is the lowest 25% of all of the different census tracts in Fresno County. And for that lowest quartile, our positivity rate is actually quite high at 7.4, which would put us in almost into the purple. And so we've really got to get both of those metrics down to at least 5.2. And really a case rate has to be at least 3.9. And right now we're at 6.0. The bottom line is we need to be doing more testing. Please be doing more testing. If you're offering evening and weekend hours for testing, thank you so much. I really hope other providers will do that because we're hearing that a lot of patients aren't able to access testing because it's only being offered during business hours. And please work with us to help create a model that works for you and works for us also. Going back to some of the questions in the chat, should providers get involved to assess patients to decide if a flu test or a COVID test or both be conducted in patients that are symptomatic? Yeah, actually providers should get involved. Last year, if a person came in with the sniffles, you would have to rule out influenza and perhaps things like strep throat. Well, this year you have to rule out all of those things and also coronavirus. But you're the clinician, and so you're the one that has to decide whether a test is warranted or not. And so, yes, I would say you do need to be involved. And then, are the flu shots at the Fresno Fair free? Yes, they are. Both the COVID testing and the flu shots are free for patients at the Fresno Fair. So thank you for asking those. I'll just send out this document after I'm done at the end of this hour. But thank you for asking those questions. Those are really good questions. Anyway, we need to do more testing. We actually have gotten dinged because we're not doing enough testing. If our testing rate is less than the state average, they actually adjust our case rate upwards. That's so lame, but that's how the state does it. It really makes me kind of mad because we've worked so hard to establish testing, and yet the patients aren't coming in or the providers aren't offering testing or a combination of both. So please help be part of the solution and really encourage patients to get testing. As a medical provider, you yourself are kind of at higher risk. So consider getting tested yourself. Get into a 2-week routine and get tested every 2 weeks. We have the testing available now, and you will protect yourself and your family. So get into that rhythm and maybe get your staff into a rhythm that works for them, where as an essential worker, their testing would be covered, and that would help increase our testing rates. And obviously it would help, catch any outbreaks before they happen. So those are just some of the initial kind of thoughts that I have about that. What is the turnaround time for testing at the Fresno Fair? I believe it's less than 24 hours. Because they're using PCR tests that are send outs to the UCSF BioHub. So the person gets a call back the next day at their home with the positive or negative results. All right, and the state has also released guidance related to some of the upcoming activities, such as Halloween, and in relation to Halloween, as well as other holidays. Gatherings. So they've actually got gathering guidance. So this is important because basically the state is saying, gatherings where you mix more than 3 households are considered a higher risk. And that's basically just, in writing, telling people don't mix. If you are going to have a small private gathering, that's okay. Do it outdoors, do it with social distancing, do it using masks. If you're going to eat, eat at separate tables that are far apart from each other. And only mix 3 separate households for no more than 2 hours at a time. That's basically the gathering guidance. And that has actually helped us a lot at Public Health, because this is one of the most common questions that we were fielding is, can we have this party? Can we have that gathering? Can we have this social activity? Can we have this fundraiser, et cetera, et cetera? And if it didn't fall into one of the other permitted activities, it was really hard for us to kind of adjudicate. And so I'm glad the state came out and said, well, here's the rules. If you're going to bring people together, then make sure that you do it under these rules. Same thing with Halloween. The state has come out with some Halloween guidance. Reading the details of it, there's a lot in there. Basically, the fundamentals are the same, which is, stay apart from other people, wear a mask. That's like a surgical mask, not just a Halloween mask. Obviously, be attentive to hand hygiene. They actually strongly recommend against trick or treat, which in my mind is a sacrilege, but I guess we'll work around it. I think they want people to do some kind of a scavenger hunt related to the Halloween candy, or like a pick up and go situation where you set up a table outside your house and then you just have like pre-packed candy bags that kids could just come by and pick up and take away. Anyway, just minimizing the number of crowds that you have at your front porch, which is fair. I think some neighborhoods, they actually have just tons and tons of people showing up. You can have, large crowds forming at every front door, and obviously that would be higher risk. And then obviously throwing parties or haunted houses where a lot of people are congregating indoors and perhaps screaming, and other kinds of parties related to the Dia de los Muertos celebrations. There's risks associated with all of those. So just, they want people to think through that before organizing something like this, and just making absolutely sure that they've kind of put in safety measures to keep everyone safe if they are going to be organizing these parties. So if you feel those kinds of questions, you can look to that Halloween guidance, and we can definitely look forward to other holiday guidance throughout the fall, including for Thanksgiving and Christmas, and of course Festivus. Just kidding. Anyway, there's also a lot of other miscellaneous materials related to communications that are on the state website that I found, and I added that last link just to help everyone out with that, with the miscellaneous communications. Okay, we did some local orders, and all of these orders and provider messages are actually found and located on the state website. And just FYI, if you don't know where all of these orders are housed, you might want to just bookmark this tab, because that's where every order that we sign, we post up there. If you're not getting them through your email, through the KHAN network, then you can always find them on that site. In terms of new orders, well, we finally signed the testing order for primary care. So that's live now. Hopefully that didn't surprise anyone. I think we did a really nice job getting feedback from all of you. Thank you very much for all of your comments and feedback on that. And I think this really is a step in the right direction to make sure that our community has access to testing resources. If you're still having trouble contracting with a lab, or really with any part of this order, or just have questions about who qualifies and who doesn't qualify, then reach out to us. This is actually a good time to ask those questions. You know, I know one common question is, you know, does every patient get a coronavirus test? Well, it just depends. You know, if they're completely asymptomatic and they're not one of the higher risk groups, like essential workers, healthcare workers, part of a congregate setting, then they don't necessarily qualify for a coronavirus test if they're asymptomatic. However, if they're symptomatic or part of the higher risk groups, then that will be covered by insurance, and they should get that coronavirus test done. What if they're not an established patient in your clinic? Well, that's really up to you. We hope that this would give you a chance to establish them as a primary care patient if you're accepting patients. If you're not, then you have a choice. You can either just do the test and say, you know, we'll go ahead and do the test for you, but you need to find another primary care provider. Or you can send them to a partner site who can do that test, whether that's an urgent care or some other site. You just need to ensure that they get that test done within 24 hours, because obviously any longer than that will lead to more outbreaks as that person interacts with other people if they happen to have coronavirus. So that's kind of the spirit of that order. I know that there may be other questions and gray areas, but please keep those coming. We also have an FAQ associated with that order, which really I think is a great step for us, because that will be kind of a document where we can share all of these great questions that you're asking with the rest of the community, so that people can find out what questions have been asked, how we've answered them, and go back and get more information about how this order is supposed to work. So we did that testing order. In addition, we amended the quarantine and isolation guidance order, and also the febrile respiratory illness reporting order, which we had introduced way back in April and then amended again in July. So those orders are also found on the site that I pointed to earlier. The last order that we're still working on, I should be able to sign it today, applies to schools. And this is basically going to mandate that schools test 10% of their staff that are going to be on campus, just gearing up for schools opening up. We want to make sure that we get baseline rates of infections and obviously identify if there are any outbreaks that are on the cusp of happening. We really want to get far ahead of that as much as we can. So we're mandating that schools test at least 10% of their staff, including teachers, employees, and office staff that are going to be on site when schools reopen, and that they do that every month. So we're working with some of the FQHCs to do that. So thank you to the FQHCs who are helping and have stepped up into this space. I think that you will get increased demand wherever you're working as these schools open up. There's some, frankly anxious communities and parents who just want to get tested or want to get their kids tested. And they may want to get tested, every few weeks or whatever. I can't say I know what the right answer is about that. I think that we do need to be sensitive to communities that are more concerned about infections and outbreaks, et cetera. Just because it's all over the spectrum. There's some people that are adamant that we just need to be back in schools 100% with no distancing or safety protocols whatsoever. And there's some people that say it's way too early and we shouldn't be in schools at all until there's a vaccine, and that, schools should be shuttered for in-person education until next year. And all of the opinions in between. So I think the schools are having to walk a fine balance, as all of us are, in trying to appease a lot of different opinions in this space. And I think that the models that they're coming up with are reasonable, definitely with safety first in mind. They've come up with really good protocols that we hope will serve them. And part of those protocols includes baseline testing, in addition to all of the other social distancing, masking, and other policies that they have to have in place. And our team, Dr. Zweifler, Dr. Lindscheit, David Lucchini, a lot of members of our team have been working with schools very, very intensively to make sure that schools are prepared with whatever they choose to do. Having said that, with us being in the red tier for 3 weeks in a row, that actually allows a lot of schools to open things up. So it allows elementary schools to open up without waivers. And it also allows middle school and high schools to open up if they so choose to do. And they won't need to have a formal waiver that the state approves, but we do want them to go through the attestation of doing a checklist that's much like the waiver. And the checklist will basically force them to think about their safety protocols, their outbreak investigation protocols, and other things related to keeping people safe whenever schools open back up. And we want every single school in the county to fill out that attestation and then post it online so that parent groups and teachers and employee groups can see exactly what the plan is for that specific campus. And everyone can feel good about what's going on at each school as they get ready to open up. So you're going to be hearing about more and more schools opening up. A lot of the private schools have already gone forth and opened up, and we're learning from them. We're learning how their screening process is going. We had one second grade student who tested positive, and we recommended to just do the contact investigation, and our contact investigation identified that this second grader shared a classroom with about a dozen other classmates who were all distanced and masked. So we actually recommended that they actually continue to keep the classroom going because they were following all of the safety protocols. But out of an abundance of caution, the school decided to just send everybody home for 14 days and just quarantine the whole class and just do online learning for 2 weeks. So that's the kind of situation that I think we can anticipate going forward. We're going to hear more and more about things like that. We're hoping to kind of obviously not have any mass panics, but we understand that there's going to be different levels of concern depending on how the cases are handled. But that's just one example. Already in the first 3 weeks, we've had this sort of situation come up, and it won't be the last. And so we're ready for more and more of those kinds of episodes. We're just hoping not to have any major outbreaks. And that's why we're trying to do everything that we can with the resources that we have to get people tested. And then obviously to make the schools and the teachers and the parents aware of all of the safety protocols about bringing kids back. All right. That was a deeper dive into schools. In terms of antigen testing, so antigen testing is coming up, guys. Basically, remember that if you're doing antigen testing or any kind of point of care testing, we consider you both a clinician as well as a laboratory. So as a clinician, you need to report positive tests in the provider portal. As a laboratory, you have to report all tests, positive and negative, into the laboratory portal. And all of that is detailed in this reporting advisory. So just remember that point of care testing is handled a little bit differently. And we can share more information about that if you want. It's actually counted differently too. So antigen tests aren't actually counted in the case counts. They're actually just counted as probable cases, but not confirmed cases, which is something that the state keeps track of. And we will probably start reporting that on our dashboard too as antigen testing ramps up. On top of that, just yesterday we heard that the state was allocating a bunch of these antigen cards. So this is called the BINAC system. It's made by Abbott, and it actually doesn't require a machine. It's really just like a card and then like an app on the iPhone that reads the card. So it's really high tech, and there's 18,000 of these cards that are going to be sent to Fresno County. We're having a meeting tomorrow to figure out how to allocate them. We understand that there's some congregate settings like nursing homes, homeless shelters, et cetera, that actually do not have point of care testing. So we feel like this would be a good use of this resource. But obviously there may be other places where these antigen cards are useful. Remember, antigen testing is best done in symptomatic patients, so it can't be used for surveillance or for asymptomatic patients. And you have to download this app and really do some, I think, technical training on how to do this card testing. It's not something that patients can go home and take, from what I understand. They have to do it in your office, and it still requires like a nasal swab to get it done. But beyond that, this is, again, another way that antigen testing is moving forward, and something that we will need to incorporate into the rest of our initiatives related to laboratory testing. So we'll probably have more news for you about these BINAC cards next week, once we figure out how to use them, where they're gonna go. And then obviously, if any of you have any interest in acquiring some and learning about this technology, then just please send us a message, and we will try to keep you apprised about what we find out. I'm just seeing if there's any, I think that there's a few chat conversations here. Oh, Sim just shared the health alerts and advisories tag in the chat box in case anybody wants to access it right now. Well, I think we'll just open it up for Q&A and roundtable. Let me just say that looking ahead, the things that I think we should focus on for public health, and again, I'm very blessed to have a very motivated, intelligent, very industrious team here at Public Health, and to have all of you as partners and stakeholders in our medical community. Just to kind of throw out some big sky ideas for public health, with the knowledge that some of these things have been neglected during the pandemic, and we recognize that. I just think that the main priorities for us moving into the next few months are, on top of making sure that our coronavirus response is adaptive to the needs of the moment, we need to be thinking about, you know, really getting schools reopened. I mean, I think we're just taking the first few steps along this pathway, but we really got to bring the schools back in a way that functions for everyone. So we're going to be, again, continuing to focus on that and learning from all of these school reopenings about best practices. I think we also need to focus on mental health and substance abuse issues. This is an epidemic that was already bad before the pandemic and has only gotten worse from the anecdotes that we've heard. I don't think that the actual, you know, rigorous research has been done, but the early warning signs are there that all of these psychiatric and psychological issues are getting exacerbated by the fatigue and the anxiety and all of the other stress and pressures that have been introduced as a result of this pandemic. So I think that, you know, more creative solutions are warranted for these populations. I think homelessness, we have a great opportunity and a great need in Fresno County to really create sustainable solutions around homelessness. Like I said, that Project Room Key has really brought together just a ton of collaborators and made us think really creatively about how public health, behavioral health, social services, and the homeless advocacy community can all work together. We've done some amazing things with telemedicine related to the homeless population. I'm just hoping that we can make those solutions more permanent and sustainable, even beyond the, you know, all of the funding struts that we were using to make these homeless solutions happen currently. Perinatal populations and jail populations, I think that these are populations that are suffering from, I think, a siloing effect where there's just not a lot of continuity across the medical spectrum, so that when people enter the jail system and leave the jail system, for example, or when people enter the OB and the perinatal system, and then no longer need those services. I think that there's some continuity that could be improved there. So I'm hoping that we can all come together and come up with some best practices and really figure out community-wide support networks for these populations, just because I think that will help streamline the use of resources and overall elevate the quality of care that these populations are getting. I think we do need to think about climate change. I think we've gotten out of or we're still suffering from, but have suffered hopefully the worst of a really bad wildfire season. There's other climate change issues that are going to be more chronic, and I think it would be naive to ignore them right now. I think we really just need to start thinking about how, there's public health impacts. I'm getting messages from actually the media, the national media, that are now focusing on climate change impacts in Central California. I mean, they've seen the stories about the wildfires. They understand that we have chronic illnesses related to pulmonary diseases for other reasons. And now the confluence of all of those is actually a matter of concern. And I think that we could probably be doing some discussions as well as interventions that would help people stay healthier, just knowing that we haven't seen the last of the wildfires for this season, and that there may be many more years where we experience similar kind of effects. And then there's a lot of other things that should be on this list that I need your help to help elevate. So please reach out to us if you have other issues or that you're passionate about, that you think that the whole medical community should work on together. I would love to discuss these kinds of, like I said, big sky ideas with colleagues and stakeholders in the community. So please reach out to us or unmute yourself and share any ideas that you have or thoughts that you have about this. And that's really all the remarks that I have. I think we have lots of time for questions and answers and commentary. Thank you.
Hi, Doctor.
Hi.
Hi, this is my name is Gilbert. I'm the office manager at Everyday Healthcare in Fresno.
Hi, Gil.
Hi. We've been doing this antigen 15-minute testing. It's a drive-in testing in our parking lot since July. In the beginning, we were doing 120 tests a day. Now we're doing about 60 to 70 tests a day.
Okay.
But we only offer those Monday through Friday, like you said, during business hours. And you stress that there's more testing needs to be done. You think I should open up to a Saturday testing?
Yeah, if you have the bandwidth to do that and the resources, Gil, I think what we're hearing is that especially essential workers, maybe the ag workers, may not have time during the business week to get tested, even if they're at higher risk. For a lot of different reasons. Part of it is just finding a place to get a test done. And part of it is, what if it comes back positive? Then they have to miss work.
Right.
And that's sometimes a hard decision for them to make. In some ways, we're trying to help with that because we do have resources available through our agricultural partners to offer them. Well, first of all, their employer should offer them time off with pay. Second, the agricultural partners have places that they can go to in terms of hotel rooms if they need to quarantine away from their families. Really, you can start with that by helping with that conversation, just by getting them in and getting them tested. And then the FAQ that we developed with the testing order actually has links to all of those resources. So you can actually find that FAQ. Let me see if I can find it. And then basically we can obviously get them pointed in the right direction to go ahead and find a hotel room if they need to find one.
Gotcha. Would you be able to help me get the word out that I'm now changed to, I can open for Saturday business, testing on Saturdays?
Sure, yeah. If you could, in the chat, Gil, give us your information, either a website or the name of your clinic, and make sure that we elevate that message and push that out.
Okay.
Yeah, thank you so
Thank
much.
you.
Appreciate everything
Thank you.
you're doing.
Thank you.
Are we still open for?
Yes, hi, Deborah.
Hi, I wanted to ask you, Dr. Vohra, if he's using the reimbursement code for COVID counseling to encourage isolation.
Okay, great. Yeah, thank you. I think we've added that to our order as well, Deborah.
Oh, great, okay.
Let me try to find that order if I can.
I just sent the link to everyone with the announcement from CMS.
Oh, you did? Oh, perfect. Thank you so much. Perfect. Let me see here.
Dr. Vohra, this is Sim. In the chat, I put the testing order with the FAQs. It should be a little bit
Oh, you
further.
did? Okay, great. Thanks, Sim. Let me find it here. I'm so bad at driving and zooming at the same time.
Oh, no.
Yeah, so you could see those codes that Deborah has shared. And here's the testing order that, let me see if I can, I think I have to share my screen again. Here's the testing order. Can everyone see that? And at the bottom of the testing order, there are FAQs starting on page 6. And these are labs that will offer testing. I think somebody asked if the labs would offer free testing. And I'm not sure I understood the question. I mean, the testing should be covered by the person's insurance. And they should be able to qualify for at least Medi-Cal. So beyond that, I think you'd have to work with the lab to see exactly how the funding would be covered. If you're really running into roadblocks, then contact us. But we want to be the payer of last resort. We really want the insurance, including Medi-Cal, to be the funding source. Going back to Gil's question about resources. So that's way down here on page 7 of the FAQ. Oh, and that's why I don't like to drive. Okay, so let me go here. Page 7 of the FAQ, which is like page 12 of the actual document. And basically, there's a question about how you can get them resources to quarantine. Sorry, I can't find it on the fly, but I know we put that in there. We'll try to find that and share that out. I thought we had a question in there about the resources for agricultural workers. If not, then we'll add that in and amend this packet. But basically, we wanted to have a quick, easy link where people can go to find those resources. Oh yeah, what if my patient needs support to remain in isolation? The Housing for the Harvest program supports patients who are farm and food processing employees who may need help with housing. And then if you click this, this is just a form that they fill out that then helps with supporting their housing needs. So like I said, that's in the FAQ. Sorry, that was kind of buried in there. but that's on that's in this packet. That's the October 9th officer order. Right, more questions on the chat. Okay, great. All right. Any other questions? Kelly Klassen from Pregnancy Center asks, I work at a primary care clinic that offers specialty services. We provide an initial pregnancy test only. On the order, it states that facilities must provide diagnostic testing for COVID. I'm assuming we're considered an ambulatory care office. Well, again, I would say this is very parallel to influenza. So if a woman came to you with influenza-like illness, would you test them for influenza? If the answer is yes, we would, then you should also test them for COVID-19. If you don't test people for influenza, then wherever you send them to get tested, that's where you need to refer this patient for COVID-19. I hope that that clarifies. That's kind of the very basic rule of thumb that I'm using for this. I just think that whenever flu season hits, that's exactly what you're going to experience, is you're going to get patients coming in and you're going to want to know if they have influenza or COVID, and you need to be able to test for both at the same time. So I hope that that's clear about who this mandate is for. Somebody's asking, the new COVID handouts for the patients have a copy of the health order attached. Does the order have to be given out to the patients too, or only if they ask about it? I don't think that they need to have the order. I think that if you want to you probably have your own set of discharge instructions. Just copy and paste the most important parts of the order into your own discharge instructions. And then you can actually just paste the hyperlink to the actual order on their discharge instructions too, so that they can have that. And they can go back and look at it. So that's basically how I would handle that. They don't need to have a copy of the whole health officer order, in my opinion. And then someone is asking, I don't know if this is Chris, let me know if you want to hear about the blood shortage. Yes, we do. Please tell us about the blood shortage. If you can unmute yourself, this is something that we do need to mess with.
Hi, Dr. Vohra. Can you hear me?
Hi, Chris. Yes, we can.
Hi. Good afternoon, everyone. Those of you who were on the call last week, you heard that our region and the entire nation is in the midst of one of the worst blood shortages in memorized history. And so a lot of that is because everyone is just stressed out from worrying about the pandemic, worrying about the wildfires, worrying about when their kids are going to go to school, and the regular blood donors, so to speak, who make up about 3% of the population, they're just tired. And I think we need to get everyone conscious of the fact that we are in the middle of a blood shortage. We have hospitals that are on less than 1 day supply of blood right now, and things have improved a little bit over the past week. Thanks to many of those folks who responded since last week. But we won't be out of the woods for a little while longer, and we need everyone to, every healthy individual to consider coming to one of our local fixed sites and making a blood donation today, tomorrow, the next day, as soon as possible. Anyone capable of having a community blood drive with us, please reach out to us. We can be reached at donateblood.org. And also information about our fixed sites and when they're open is also available at donateblood.org. For those physicians who treat COVID patients and for those hospitals handling COVID patients, I will give you an update on COVID convalescent plasma. The supply is very good right now. We have over 300 units available. And so thanks to all those folks who recovered from COVID have been steadily donating their plasma. So we've had great success at producing that therapeutic product for investigational use. And so physicians can be assured that we have a great supply, and they can call the blood center to get COVID convalescent plasma. But most importantly, right now, we need healthy, regular blood donors just for all the other problems we have, requirements for blood transfusion, from trauma, oncology, labor and delivery, cardiac surgery, all other surgeries. So the need is great for blood donation. Thank you, Dr. Vohra.
Thank you, Chris. Very important messages. So if you want to be a good citizen today, get yourself tested for coronavirus and get yourself to a blood donation site and donate blood. Those are the two most important things that you can do to help our county.
Thank you. Thanks, Dr. Vohra.
Thank you, Chris. Appreciate everything you're doing. Any other questions or comments? All right. Well, I think we'll just go ahead and adjourn, and we will hopefully be able to do this meeting again next Wednesday with more updates. Please keep your questions and feedback coming. Please take time to take care of yourselves and your loved ones, and have a great rest of your week. Thank you very much.
Thank you.
Yeah.
Thank you, doctor.